Hey everyone, welcome back. We're doing a deep dive today and going deep on acupuncture.
Oh, very nice.
Yeah, and specifically, if it can actually help chronic knee pain.
Okay.
You sent over some really interesting research on this, and
Okay.
I think a lot of people are really interested in this topic.
Absolutely. So
Yeah.
a lot of people deal with this.
Let's jump right in.
Oh, sure.
One of the things that you sent over was this study, which
Yeah.
I know is like the gold standard.
It is the gold standard.
Yeah, for medical research.
Yeah, randomized controlled trial.
Right.
Yeah.
And I think this is a really big deal for people to see that there's actually like legitimate research
Absolutely, yeah.
going on in this area.
Yeah, so this is really going to help, I think, give us some good information to talk about.
So,
This study looked at
yeah, tell me about the study.
282 patients,
Okay.
all over the age of 50, and they all had chronic knee pain.
Chronic meaning like they've been dealing with this for a while?
Yeah, at least 3 months or more.
Oh, wow.
So significant knee pain.
Yeah, this isn't just like I tweaked my knee yesterday.
Exactly.
This is like something that's really been affecting people.
And they divided everybody up into 3 groups.
Okay, I was going to ask that. So
Did everybody get acupuncture? Or?
No. So if they're like,
That's what makes this a really good study,
yeah.
is they had one group that got the real acupuncture.
Yeah.
They had another group that got sham acupuncture,
Okay.
which is basically like a placebo.
Right.
It's not real acupuncture.
So they're probably not even like putting the needles in, or are they?
I think they do put needles in, but they don't put them in the right spots.
Oh,
You know.
what?
Or they're not doing it in the same way.
Gotcha.
Um,
Okay.
And then a third group that just got like standard care.
So like
Whatever they were already doing.
just kind of the control.
Yeah, exactly.
Okay.
So that way you can really compare,
Gotcha.
you know.
That makes a lot of sense.
Yeah.
So, so we know there are these 3 different groups.
Right. And in the group that got
Yeah.
the real acupuncture,
Tell me about what they actually did for the real acupuncture.
well, they targeted very specific acupoints.
Okay, so for people who don't know, what are acupoints?
These are basically points on the body
Yeah.
that traditional Chinese medicine
Right.
uses.
It's like these specific spots.
And they believe that it influences the flow of energy in the body.
Mm-hmm.
And so they targeted specific ones for knee pain relief.
So it's not just like,
Yeah.
oh, we're just putting needles all over your legs or whatever.
No, it's very specific points.
So is that something that like they would have needed to like learn and study to know where they are?
Absolutely, yeah.
Yeah.
There's a whole system
Yeah,
to this.
yeah. Okay, so they're using these specific points.
Right.
And is that kind of it, or is there more to it than that?
Well, I think
like how
it's important to point out that they used sterile single-use needles.
that's good. I was hoping that they did that for
Yeah.
safety's sake.
Yeah.
All right.
And they inserted them to a very specific depth.
Okay, so this isn't just like,
Yeah.
I'm just going to poke it in
Yeah.
until it hits something.
It depended on the acupoint and also the patient's body.
So there's like nuance to it. It's
it's
not
like-
just,
It's not a one-size-fits-all approach.
yeah, okay.
And then they left the needles in for 30 minutes per session,
Oh, wow. Okay.
twice a week for 6 weeks.
So they're getting it pretty regularly.
Yeah,
So, okay, so over the course of 6 weeks, they're getting all these treatments.
that's right. And then they tracked the results.
Yeah. How did they know if it was working or not? Like, how did
Well,
they track it?
First of all, they used a visual analog scale, or VAS,
Okay.
which is where patients just mark their pain level on a line.
Okay, so like a 0 to 10 kind of scale?
Yeah.
Okay.
They also used the WOMSC index,
Okay.
which assesses pain stiffness and physical function in people with osteoarthritis.
So these are pretty specific to the knee?
Right.
And
They're
like,
really-
how it's affecting their life?
Trying to gauge,
Yeah.
how well they can move,
Right.
how much pain they're in,
Gotcha.
how stiff they are.
Okay.
And then they also used the SF36 health survey, which just gives you a broader...
Okay,
Treat-
so that's kind of like quality of life stuff.
Exactly. Yeah.
Yeah.
Overall well-being.
Okay.
Um,
And they track these all like at the beginning
that's right.
and then right after the treatment.
At baseline at week 6, and then
Okay.
they followed up at 12
Well,
weeks
even longer term.
and 26 weeks.
Wow, okay.
So they wanted to see if it lasted.
Gotcha.
Yeah.
All right, so I'm dying to know
Yeah.
what happened.
We'll talk about the results in a minute.
Okay.
But-
Or I'll tease that. We'll tease
Yeah.
that for the next part.
For sure.
But yeah, this is really interesting. Okay, so we left off talking about this really interesting study on acupuncture and chronic knee pain.
Right.
But I'm really curious to hear
Yeah.
what the results were.
Okay, well, the group that received the real acupuncture,
Mm-hmm.
they saw a significant decrease
Okay.
in their pain levels.
How much are we talking here?
On average, 20 millimeter
on that.
on that visual analog scale.
Oh, wow. Okay, so that's a pretty big drop.
Yeah, that's significant.
And what about the sham acupuncture group?
They only saw a 10 millimeter decrease.
Okay.
So in the control group, just 5.
That's a huge difference
It is, yeah.
between the real and the sham.
Right.
That's really interesting.
Yeah, so that really suggests that there's something going on
Yeah.
with the actual acupuncture itself.
So it's not just like a placebo effect.
Exactly.
Okay.
And what's even more impressive is that the pain relief
Yeah.
wasn't just temporary.
Oh, that's really important for people to know.
Yeah, because a lot of times with pain treatments, you get like a short-term
Right.
benefit.
But then it comes right back.
But this one, they followed up 26 weeks after the treatment ended.
Wow, that's a long time.
And the acupuncture group still had a 15 millimeter reduction
That's amazing.
from where they started.
So even 6 months later,
Yeah.
they were still seeing benefits.
Yeah,
That's really great.
it is.
Okay, so we talked about those other measures too,
Right.
the WMAC
Yeah.
and the SF36.
So the WMSC scores.
Did those show any changes as well?
Yeah, they showed that the real acupuncture group had better physical function
Okay.
and less stiffness.
That makes sense. If they're having less pain, they're going
Okay.
to be able to move better.
Exactly.
What about the SF36?
Yeah, that one is really interesting.
Okay.
Because they reported improvements in both their physical and mental health.
So it's not just about the physical pain. It's like
Right.
an overall sense of well-being.
Exactly.
That's really fascinating.
It is. So I know you might be wondering, how does this work?
Yeah, like...
What's the science behind this?
Mm,
How are these needles
yeah.
actually doing anything?
Well, the researchers in the study,
Okay.
they didn't just stop at measuring pain and function.
Okay.
They also took blood samples for
Interesting.
the participants
Okay.
before and after treatment.
So they're looking to see if there are any
Yeah.
biological
Physiological changes.
changes happening.
Yeah, right.
Okay. And what did they find?
Well, in the group that received the real acupuncture,
Yeah.
they found a significant decrease in pro-inflammatory cytokines.
Okay, hold on.
Yeah.
Back up for a second.
Sure.
What are cytokines?
So cytokines are these molecules
Okay.
that play a key role in inflammation.
Okay.
And we know that inflammation is
Yeah.
a major factor in pain.
So it's not just about blocking the pain signals or something.
Right.
It's about actually addressing the inflammation itself.
Exactly. So if you can reduce these inflammatory molecules,
Yeah.
you could potentially be addressing the root cause of the pain.
Rather than just masking the symptoms.
That's really important
Yeah,
for long-term healing.
absolutely.
Okay, so they found these lower levels of cytokines.
Right?
Did they look at any specific types?
Yeah, they looked at 2 key cytokines,
Okay.
IL-6 and TNF-alpha.
Okay, I've heard of those.
Yeah, and both of those.
They're involved in inflammation?
Yes.
Okay.
And they were significantly lower
Wow.
in the people who received the real acupuncture treatment.
So that's really interesting that something,
It is.
we think of as being ancient.
Right.
This acupuncture
Yeah,
can actually have a measurable effect on our biology.
exactly.
That's pretty cool.
Well, it is, yeah.
So what does all this mean for someone who's
Right.
listening to this
Yeah.
and they're thinking,
Right.
okay, I have chronic knee pain.
Mm-hmm.
I'm interested in maybe trying acupuncture.
This study really highlights
Yeah.
the importance of a well-researched
Mm.
and specific approach.
Right.
So it wasn't just random needle placement. They
Right.
used specific acupoints.
Right.
They had a consistent treatment schedule
Uh-huh.
and a specific needling technique.
Okay. So it sounds like it's not just as simple as just going to any acupuncturist.
Right.
Like,
Yeah.
they need to know what they're doing.
You want to look for somebody
Yeah.
who's trained in this
Okay. So
specific protocol.
if someone's looking into acupuncture,
Right.
what should they be looking for in a practitioner?
Well, it's
And-
always best to consult
Okay.
with a qualified practitioner
Right.
who can assess your individual needs
Yeah. Everyone's different.
Right.
Okay.
and tailor the treatment accordingly.
So it's not just a one-size-fits-all
Okay.
approach.
Yeah.
Okay.
And I think this study,
Yeah.
while it focused on knee pain,
Uh-huh.
it also opens up
Interesting.
interesting possibilities
Yeah.
for exploring
Okay.
acupuncture's benefits
Other types of
for
pain.
other types of chronic pain.
That's really exciting.
It is, yeah.
Okay. I guess kind of to sum this all up,
Yeah.
what would you say are the
I think the biggest
biggest takeaways from all this research?
takeaway is that. I
Yeah.
think the biggest takeaway is that acupuncture can be a really effective treatment
Yeah.
for chronic knee pain.
And it's not just like masking the
Yeah.
pain. It seems like it's actually
Yeah, they saw actual changes
Yeah.
in those inflammatory markers.
Which is huge
Right.
because that means it's like actually addressing the root cause.
Absolutely.
That's really cool.
Yeah, and the fact that the benefits extended beyond pain relief, too.
Right.
Like they saw improvements in physical function
Yeah.
and even mental well-being.
Yeah, that's really interesting.
Yeah.
I feel like mental and physical health are so connected.
They are. Yeah, it's all connected.
So it makes sense that if you're feeling better physically,
Mm,
it's going to have a positive impact on your mental health as well.
absolutely.
So I think that's what makes this research so compelling. Acupuncture. This sounds
Right?
promising.
Yeah.
What advice would you give them?